Hello and welcome back to, or just to, Fascists and Fasciae, Dissecting Medical History. This is an ode to the human body and a dissection of its role in medicine, philosophy, art, politics, and just about everything else you can possibly think of, because that's what Svet and I believe. We believe that the human body is central to pretty much all of these things. This is the beautiful Svet.
And this is Brendan.
I still don't deserve an adjective, apparently.
That will come in the following episode.
I hope so. Across time, we've exalted it in marble and we've eviscerated it on the table. In this podcast, we look at how the human body has been dissected, worshipped, politicized, pathologized, and poeticized across cultures and time. Svet, I think we have a very, very interesting podcast episode.
Okay. So first,
we're gonna watch out for the I word.
And as this is the first take of this podcast episode as well,
First take.
take one. I have opened now for the people that don't know, so probably everyone. I have opened the Cambridge Dictionary.
I'm gonna do that as well.
Under interesting.
Cambridge Dictionary. Interesting.
Now we are armored with varying and diverse synonyms to the word, which we're gonna exercise and play with.
I like that. Some enthralling synonyms.
Enthralling synonyms. See, we've
like
already
that.
started. So
Let's make it a game. If you say the same kind of thing that vaguely has anything to do with
Right.
the I word,
Yes.
then you lose.
I lose what?
If you repeat it, then you lose
The game.
the game. Today, yeah, that's part of the game
That's
today.
part of the game today.
Anyway, let's go back to it. What are we talking about today?
we talking
And what
about?
is so intriguing that we want to
Ripping.
discuss?
So the riveting topic of today's episode is probably the most illogical nerve in the human body, or illogically designed, if I have to be more precise.
Well, yeah, we have to be precise. Yeah.
So let's try with that, because it's a precise, yes. No, actually, yeah.
It's an engrossing
It's
nerve.
engrossing. I was trying to think of another synonym at the same time. But yes.
Yeah,
So back to basics.
it's exhilarating.
The most illogically designed nerve in the human body, which is
Well, what is it? Well, yeah, let's first talk about where it comes from.
let's talk about that.
And kind of understand why it's illogical.
Right.
Well, really, if you dig deep, it is not illogical. But on a superficial level, it really is. And why is that? What nerve does it come from? Where does it come from?
Where does it come from? So it's a branch of the infamous vagus nerve, which a lot of you will be familiar with. So vagus nerve is one of those nerves that is part of the bunch of cranial nerves, the longest one of them.
How many are there?
12, just to make that clear.
Yeah.
See, spot on.
Yeah.
And that one is extremely interesting because obviously it has a lot of mixed functions, but parasympathetic nerve, sensory functions, motor functions, whatever. It exits through the jugular foramen, from the midbrain, and from the medulla, to be more precise there as well. And that's the level of detail that we're going to go into now, and probably a bit deeper afterwards as well. Thank you for the nonverbal science.
Yeah.
And its branch, the recurrent laryngeal nerve.
The recurrent laryngeal nerve. So the recurrent laryngeal nerve, or maybe we'll some point in the episode say RLN, just out of
RLN.
comfort. We're not going to say the Latin term because that's also a mouthful.
Okay.
Not that I can't say it. I have no problem.
We're not going to go there. But side note,
It's easy.
we stop there and we continue.
Yeah. Anyway, so the recurrent laryngeal nerve. This nerve on the surface, and we're going to explain today why it's not. It makes no sense. So this nerve goes from the brain and it travels all the way down into our chest and it goes back up to our voice box, to our larynx.
Yes.
Hence laryngeal.
Laryngeal.
Now, this seems very illogical on the surface, as we mentioned, because it goes all the way into the chest. On
Just to
the
go
left,
back.
yeah, just to go back. Makes no sense. Why doesn't it just go straight there from the brain, even
Right.
just like that? Oop.
That's
Yeah.
what I would do.
Yeah, that's what you would do if you were a nerve. You would do that. Yeah. I don't know if I would do that. I would go just for fun. I would go down to the heart, check it out, see what's going on, come back up. Anyways, let's stop.
Yeah.
On the left, it hooks around the aortic arch,
Mm-hmm.
which I'll show a nice diagram of the basic anatomy of the heart and major blood vessels
Here somewhere.
yonder somewhere.
Yes.
And on the right-hand side, it hooks around the right subclavian artery. Very strange, not even symmetrical. I don't like that. I like things when they're symmetrical. So.
Okay.
But I do like it because it's peculiar. So I do like it. It's an amusing nerve.
Let me open that word as well. Go on.
So it goes back up. It follows the course of the vagus nerve back on the way upwards, more or less, up towards the larynx. Now, what is particularly strange about this is that the recurrent laryngeal nerve is essentially responsible for pretty much every single muscle of the larynx. Intrinsic muscle of the larynx is a more precise way of describing it. So muscle inherent in the larynx, structures which act on and of the larynx. Apart from one.
Apart from one.
Do you know which one that is?
Once again.
Once
It's
again?
the
What do you mean once again?
cricothyroid one.
Cricothyroid.
That's probably the longest word that I can say.
Cricothyroid, is it?
Is it?
Yeah, of course it is,
Oh,
Svet. But you doubted
got-
yourself.
oh,
Never
that's-
doubt yourself. That was good.
Oh,
So all of them, apart from the cricothyroid, are innervated by the recurrent laryngeal nerve. The cricothyroid is innervated by the logical half-brother, let's call it, of the recurrent laryngeal nerve, and that is the superior laryngeal nerve,
That's
which
the one I made.
which
That's the
comes
one I
off.
designed.
Yeah, Svet made that one. Yeah,
Goes directly to the
yeah.
larynx,
It was
as
made by
should.
Svet. Age. How old were you when you discovered it?
So 300 million years ago. So it's
300
like
million. Only
minus.
300 million.
Just put like minus on that.
A long time ago, anyways. Oh, 300 million. Spoilers. Anyways, so sound production. How is sound production vaguely done? Let's talk about that briefly. So the main kind of functions of the larynx. The larynx is this kind of dynamic valve which separates the windpipe, the trachea, from your throat. So it stops one thing that it does, as you can imagine, when you're swallowing food. You don't want your food to go in there. So part of the larynx stops that. It prevents aspiration. Same with the vocal cords, also prevent aspiration to an extent. What else? But what can the vocal cords themselves do?
Yeah.
The vocal cords can move in two main directions, of course, and that is abduction and adduction, which we will, I'll show a diagram of what that means in the case of the larynx, but that really means opening and closing. Abduction being moving away and adduction being moving towards. Like, for example, right now, I'm abducting my arms,
Right?
my shoulders, really. It's a
Yeah.
shoulder abduction.
And
And
adduct them.
when they come back, they're being
Yeah, abduct
adducted. They're being brought back. So an alien is abducting something. It's taking something away. But adduction is bringing it back. So I guess if an alien
I
is
was
feeling...
surprised by that drift.
But if an alien is feeling
sidetracked.
very, very friendly, then maybe it will adduct you afterwards, after it probes you.
Yes.
Anyways.
Anyways.
So when our vocal cords are open, they're in abduction. They're abducted. And when they're in that position, that's when breathing takes place, of course. So the vocal cords are open, so the airway is open, so air is able to flow in and out.
And maybe, because I'm going to play now the role of obviously an audience member there. So the
Role.
question, the role. So the question would be now,
Yeah.
so you're saying abducting, so you open the valve mainly, just
Yeah.
to summarize it once
Yeah.
again. And this function is supplied then by
Which,
the
you know it.
the
You know
recurrent
it.
one.
The recurrent one,
Okay,
yeah.
So that's important.
Well, it's by almost every single muscle, so you can just
Exactly.
guess. If you can guess for functional larynx, just guess it's
gonna
the
be from
recurrent
that one.
laryngeal. I
Okay.
mean, there's only one
Yeah.
muscle that isn't. So, but that's beyond the scope. Let's not get into every single muscle.
No,
Let's
no,
not talk
no,
about the
just for
cricoarytenoids and all that.
I was a
fun
little
stuff.
sidetracked there.
It's a fun sidetrack, but we're going to keep it a bit
Back
more
to
theoretical.
business.
Back to business. So breathing is when it's open, as I mentioned. When it's closed, our vocal cords are put next to each other, and when they're placed next to each other, that's when vibrations can actually occur. So vibration, think talking, singing, all of this, what allows us to have such beautiful voices and stuff like that. That comes from our ability to adduct our vocal cords. So that's why the nerve is one of the most important structures that we need to be careful of, especially in surgery in that area. Because if you damage it, you can imagine, as you can imagine in the human body, when you damage something, it doesn't work properly. And when it doesn't work properly, it can't carry out its basic functions, which in the case of the RLN, there are a lot. Now, so it's strange though, such a goofy nerve that goes all the way up and back around, has such an important function for speech
But
and for
now we know-
communication by consequence, of
But
course.
now, indeed, you've highlighted very nicely the function. You've highlighted more or less the anatomy of it, and it's always interesting. Well, now
Oh,
be careful.
hey.
Okay, it's always
Mesmerizing.
mesmerizing.
one.
Indeed, that's a
Yeah,
good one. Okay,
mesmerizing.
it's pretty much it's always mesmerizing to look at why things are the way they are. Because you can always say, you can always give an answer of,
Yeah.
okay, that's how it is because of the blueprint. Okay, but who drew the blueprint?
Yeah, I find
in
that
a
so.
metaphor.
I find that so tantalizing.
Right?
Yeah,
We're going very deep with that.
I
one.
find it splendiferous.
So where do
Yeah.
we have to go to find who drew the blueprint for this?
Well, blueprint I wouldn't quite say, but let's go back to embryology.
design.
Let's go back to embryology. So let's
Yeah.
talk about what our anatomy looked like before it was the anatomy that it really is, before it becomes anatomy, really.
Okay.
So in embryology, the most important structure to talk about, or the most important group of structures, let's say, is are the pharyngeal arches.
Yeah.
The pharyngeal arches, of which there are 6. more or less.
Mm-hmm.
Let's not get into that. Of which there are 6. And there are a series of 6 segmental and bilateral arches and pouches also. So the arches being the arches, and the pouches being the kind of grooves in between them. And we'll show a picture of that so you can look at it. It's very complicated. We could talk about it for 5 hours, but we're going to make it very condensed and keep it very simple, factual, and to the interesting parts. Anyways,
Okay.
each nerve, each arch has a nerve, artery, and muscle, which is a very important thing to think about. And they start from about week 4 of embryological development. These come into play, the pharyngeal arches. In the case of the RLN and stuff, what ones are important? So SLN, so superior laryngeal nerve.
Yeah.
That comes the logical Svet's nerve.
The one that goes directly to the larynx.
Yeah, we in Latin they call it nervus sveti. Yeah, it's
that's why it's
Svet's
SLN,
nerves.
by the way.
Yeah,
that makes sense.
Svet's laryngeal nerve, SLN. It comes from the 4th pharyngeal arch, but we're going to ignore that.
No,
it's fun, but we're going to stick
just
to the
read
6th
about
one,
them.
number 6. If you feel like reading about the pharyngeal arches, which I think you'd probably be the only person on the planet who wants to, apart from maybe me.
Well,
I don't know about you.
Then the 3rd one,
and of course the teachers
I had to look prepared as well
and
for that,
embryologists and people who enjoy reading about this nerdy stuff. Anyways, embryology is a bit of a hated subject in medical school and all of that kind of stuff. Anyway, so I wouldn't expect too many people, but it's very cool.
At least 2 have.
It's very cool.
So
yeah. Anyways, back to business. 6th pharyngeal arch. So okay, but what is the nerve? So we've established recurrent laryngeal nerve is the nerve of the 6th pharyngeal arch. But as I said, it comes with an artery as well. Always, and it also always comes with a muscle. Now, the thing is, in embryology, our heart starts up in our necks. It starts up quite high in our necks, and when our heart is there, the artery of the 6th pharyngeal arch is ductus arteriosus, which is essentially the fetal circulation's connection between the right and left side of the heart, so oxygenated and deoxygenated blood. So it's basically a kind of innate bypass that we have. And nowadays it doesn't really exist in us. It's a ligament, but it stays where it is. So we have a ligament instead of an artery. And that is why the recurrent laryngeal nerve on the left hooks up around the left aortic arch, because it gets pulled down, because we start with our heart up here, and as it moves down into our chest, it's logical that the nerve, of course, with big arteries coming out of the heart, if they're together from the same pharyngeal arch, that the nerve is going to be pulled underneath and it gets stuck. So it gets pulled and elongated outwards. And maybe I can pull up a cool GIF or something. Maybe I'll make a GIF. I don't know. Sounds cool. But on the right side, what happens is the artery, it disappears on the right side embryologically. And so it jumps up to the next artery, which in this case on the right would be from the 4th pharyngeal arch, which is, also fun. So in the case of the right, it's on the subclavian artery in our bodies nowadays, because in embryology, the one on the right from the 6th pharyngeal arch disappears. So that means that essentially what happens is the right recurrent laryngeal nerve is much shorter than the left one, which has a significant role in pathology, which we'll mention later when we talk about a bit about more medical kind of clinician kind of perspective of this stuff. But I've read somewhere, it kind of varies in the literature, but they say on average, right recurrent laryngeal nerve somewhere between 4 and 9 centimeters, usually about 6 maybe, and the left one somewhere between say 5 and 12 or something. So around 10 is what they usually say. In any case, longer. But we've established Svet, you really wouldn't design it like this. Svet,
SLN made sense to me. Like,
I mean, you found it.
The function is there. Location should be more or less logically also in the same area. But then for Ireland, something else happened. And, we've covered embryology, which was nice.
Who is R?
R?
Yeah, who is R?
That is a good question. But I think now we can give an answer kind of to it.
Yeah.
Because we're going
make
to
something up.
Fish. We're going to fish.
Let's talk about fish.
Let's talk about fish.
I like fish. Because, Svet, you wouldn't have designed it like this, but time would.
Time would.
Time did.
Time actually did, yeah.
And maybe it'll design it in a different way in the future. But let's talk about evolution.
Yes.
So, fish. We used to be fish, kind of. And evolution itself is not random. It's kind of structured chaos, if we put it like that. So why? But in humans, why does the heart start here and end up down here? Why does it not? Why does it not do that movement in fish? Well, the reason why humans we evolved from fish-like creatures, of course, So we evolved, in a sense, to have a neck.
Yeah.
These fish-like creatures in water, they don't have necks. They have a head which is directly attached to their thorax, to their chest, which is very different to us. Of course, we have a head and we have a neck and we have a thorax. 3 separate structures. I can move my neck in all kinds of crazy directions.
Yeah.
Thankfully, I really like that feature.
Find a fish that can do that.
It's,
I don't think there are a lot of those.
I don't know.
laying
I
around.
don't know them either. But that's the problem though, because when fish moved onto land, different air pressures, different feeding habits. Oh yeah, and we lost the gills, of course.
First, I think
I don't have gills. Do you have gills?
I haven't found them yet.
He hasn't found
But I
them.
still
You haven't
look
found them
for
yet.
them. I
Okay,
still
well, if
look
you
for
still
them,
look
though.
for them, then you still think maybe there's a chance you have gills. Okay, so you're like a kind of like in the between kind of
In
creature.
between, I'm like in one of those stages, intermediate stages of evolution. You know,
That's like the
still.
missing link. Ah, Svet.
That's right.
Svet the missing link. Fishman.
It's a nice movie.
Okay, yeah, this is a nice movie. So we evolved onto land. We lost our gills, and we started. We're tetrapods. We have four feet. Yeah, in our case,
4 limbs.
Yeah,
Let's say 4 limbs.
let's say 4 limbs. But I was thinking about 2 etymologically, as usual. Early vertebrates didn't have that. So the movement from fish towards mammals, it meant that our heart decided to move out of the way. Our neck started to need to move around a little bit more, dance, stuff like that, so we can actually use it for other functions. But in fish, these our pharyngeal arches are their equivalent to fish gill arches.
Yeah.
And these ones you really like, which I guess
gills.
explains,
Yeah, because there the design is simple. Because obviously you have these, more or less gills just which are also symmetrical.
Yeah.
So then all of these arteries, nerves, and stuff, they basically go where they have to go. Like
Yeah.
they're like it's like a nice tree.
where they have to go.
We're gonna have an image there.
That sounds very judgmental. That you think there's something wrong with humans.
I think it's designed in fish. It was designed perfectly, and then something happened along the lines, which we should have corrected for some reason.
Well, I mean, a fish goes directly from brain to gills, right? I don't know why I pointed here as if I have gills, but brain to gills, and I mean, the heart was also right next to the
Very
gills.
close to them as
Everything
well.
right there.
Exactly.
So they never had any issues that can arise in humans or other species because of this recurrent laryngeal nerve, because they didn't really have it. In any case, let's think about some crazier examples, right? Because fish, very cool. Or shout out to fish.
Shout out.
I mean, you have to respect them.
Yeah.
Humans, it's very weird. I mean, I have a long neck. Often I'm referred to as a giraffe. Not a very creative nickname. Just because I'm tall. I mean,
Okay.
you can't think of anything else that's tall.
Now.
Call me something. I don't know. Call me something else. I don't want to give too. Call me like a brachiosaurus or something.
Yeah.
Call
but
me.
you're
like
giving too many spoilers right
that's
now.
a bit of a spoiler.
I will stick with
Anyway.
the giraffes.
Giraffes, so they can have very long necks,
Yeah.
just like me, but much longer than mine. And so that means that the recurrent laryngeal nerve, which does exist in giraffes as well, of course, can travel, and I read around 4.6 meters on average is how long the recurrent laryngeal
For
nerve.
reference, can we use? We can use a
For
football
reference,
field, no?
a football field is a little bit too big for
Right?
reference.
Because they always use that football field. It's a bit annoying.
Let's
Let's
it
use.
doesn't work.
What was it? 2. So you were 2 use basically.
2, a bit more.
2 use.
Much more.
2.5 use.
2.5, something like that.
So
About two and a
just
half. About 2.5 me.
2.5
Maybe
use
we'll make
on
an
the wall.
edit right now, and then I'll put like a giraffe neck, and then me
And
standing on top of
important,
myself or something.
That's the length of the nerve. See, that's important.
Yeah, that's the length
That's
of the
the
nerve.
length of the
Yeah,
nerve.
that's not the length of.
That's the
Yeah,
Of a giraffe.
yeah.
But yes. So going on.
Anyways, but what are the consequences for functioning? I don't really know, to be honest. I don't know if giraffes often have problems with this. I don't know if they bump into anything along the way. I don't know.
No.
Something interesting for you, one of you 3 to look up. Maybe it's cool.
Yeah.
But talking about giraffes, they also are a very interesting example of a marvelous, a spellbinding example, a fabulous example, a fantastic example of wacky anatomy and physiology. I mean, they have the highest blood pressure in the animal kingdom. I mean, giraffes' blood pressures are the highest. Why? Because their heart is so low, so their carotid arteries, which have to supply blood to their brain, have to be extremely long, and the blood has to be pumped very, very, very hard to get up there.
Riveting piece of information.
It is riveting, I agree.
Yeah.
But so it's crazy to think about how inefficient that is. I mean, you have a nerve impulse which is traveling 4.6 meters, when in reality, if you'd created it, it would have
It
been
would just be like,
5 centimeters max.
Immediate.
Even 5 centimeters seems a bit
They
of a waste
wouldn't
of neurons to me.
they wouldn't even sense it. They'd be like,
It would
they'll
just-
be
They would speak
They
much
open-
faster than us.
as well.
Every time I speak, I think sometimes. I don't know, sometimes I think. Not often, but it happens.
okay.
But in giraffes, they would
Giraffes.
just Eminem, boom, very quick.
Well,
Yeah.
giraffes. And now, but
Yeah.
there's another piece in the animal kingdom?
Yeah,
Is it-
another a very relevant one.
very relevant one.
Horses.
Horses.
Horses. Now, horses, they also have very long necks.
Yeah.
Yeah. And it's also kind of funny because horse kind of
Horse,
sounds
yeah,
like
kind of
horse.
horse.
Yeah.
Yeah,
We'll
yeah.
talk about horseness
Good one.
later, but it kind of sounds like horse. Not the same etymology, by the way.
Yeah.
Different. Not the same.
No.
I wish it was the same. That would be a great fun fact, but it's not.
We'll insert some laughter as a sound effect.
Yeah.
As well.
So what happens is in horses, especially larger horses, they often have a neuropathy of the RLN. So they have some degenerative damage to the RLN.
Yeah.
And what happens is then their airways start to collapse partially. So it's called laryngeal hemiplegia. So half of their larynx isn't capable of opening, and we know that, and we know why, because the abductor muscle is the only abductor muscle of the larynx of the vocal cords is supplied by the recurrent laryngeal nerve, as we established. So if half of the recurrent laryngeal nerve becomes damaged, or in this case of horses, especially larger ones, then they start to have a strange sounding neigh, and that's called roaring. It's called roaring in horses. And I'll try and find a video or something to put up, or a sound effect so you can hear what it sounds like. It sounds very strange.
For the effect now.
And if I can't find it, I don't know if I will be able to find it. I found it a while ago, but if I can't find it, I'll just ask you to send me a voice
think I will do
message
that.
first thing in the morning
'Cause what
and
was
just impersonate what you imagine it might be like. A horse with a hemiplegia of the
A
larynx.
reversible hemiplegia in this case, though. 'Cause,
Well, in
you know,
Europe,
I
yeah.
do it and then
And then afterwards.
and then afterwards. It just
I hope so.
Yeah.
Anyways, so roaring in horses. Evolution, it does a lot of weird things and it's not always perfect, but
It is perfect in one species.
in one species, which?
Well,
The fish.
talked about fish.
Yeah.
talked about horses,
I
giraffes.
can tell you're a fish.
But we're going to probably the most mesmerizing type
Mesmerizing
animals
indeed.
that
Mesmerizing indeed.
ever
Yeah.
dropped foot.
For drop
On-
foot.
dropped foot on this
Drop
planet.
foot.
Just dropped it, yeah.
You know what nerve that is? Drop foot.
Oh yeah.
Yeah, he knows. Okay,
Very nice.
moving on. Dinosaurs.
Dinosaurs.
One of my favorite topics to talk about, and also since I was young,
Someone
a
should
youngling.
cut this. Someone should just make a snippet out of dinosaurs.
Dinosaurs.
Us saying dinosaurs.
Should we say it more enthusiastically for me?
Dinosaurs?
Dinosaurs. I love dinosaurs. Anyways, and I always have, but especially now when I think about anatomy,
Mm-hmm.
dinosaurs are amazing. I have a book. Princeton's Field Guide to Dinosaurs is called. Has all the dinosaurs, have all kinds of anatomy about dinosaurs,
Yeah.
fun facts, their skeletons, different variations, stuff like that. I love it. It's fantastic.
A side note of it: how the they make something so interesting with such a boring name? A Princeton's Guide to
Well, it's arguable if it's interesting. It's
What was it,
pretty heavy book.
Princeton's-
Princeton's Field Guide to Dinosaurs.
yeah.
Anyways,
Yeah.
moving on. One of the most important things about dinosaurs is that there are tons of different types.
Mm-hmm.
Many know the Tyrannosaurus and the Triceratops, maybe Stegosaurus, these kind of things.
Yeah.
Sauropods as a species name, as a type of dinosaur. Sauropods meaning lizard foot, because these are the really big ones.
Yeah.
Sauropods are the really big ones with the huge necks. For perspective, it's not 2.5 me. Their neck is a lot more than 2.5 me.
10 use.
10. Yeah, maybe 10.
You
Maybe a bit
choose.
less. Maybe like 7, 8, 9, 10, somewhere in
Yeah.
that range. Depends on
Yeah.
the size. But in any case, their necks can be up to around 15 meters plus. So what's been theorized, of course, because we don't really know for sure, but I mean, the chances, okay, let's
For
say
obvious reasons.
they have, for obvious reasons, dinosaurs did have recurrent laryngeal nerves.
Yeah.
Sauropods, so Brachiosaurus, Diplodocus, Supersaurus. Anyway, these are very big dinosaurs, very long necks, and the theories go, because of course in fossilization you can't see nerves, you can't just dissect a dinosaur. Although that would be a very cool job. I would maybe consider becoming that, to be honest, a dinosaur surgeon instead of a real
If
surgeon.
they were still alive.
If they're
Yeah.
around, or if I was a Flintstone.
But we
Yeah.
could use evolution in this case, no?
Yeah, well, yeah, and I mean by the theory of evolution. So archosaurs, aka the larger family that includes
Mhm.
birds, dinosaurs, crocodilians. We know for a fact, of course, that birds and crocodiles have recurrent laryngeal nerves now.
Yeah.
So we assume, and for good reason, that dinosaurs also had recurrent laryngeal nerves, however many million years ago. Many. In any case. And that's the thing. So in dinosaurs, such as Supersaurus, so a type of sauropod, one of the ones with the really long necks, they can be up to this. Yeah, the neurons that make the recurrent laryngeal nerve can be up to around 28 meters long. And now it's different, of course, in blue whales or any of these huge whales. They have, of course, neurons making up nerves that are about 30 meters long, so bigger. But those neurons are arguably necessary. 28 meters of unnecessary nerve going like this. That's yeah, it seems very inefficient. I think Svet is getting all sweaty and uncomfortable just thinking about how inefficient that is.
Extremely annoying.
But in any case, we are based on what's called phylogenetic bracketing. We are assuming that dinosaurs had them. And yeah, it's just fun to imagine, right? I mean, and to put it into perspective, maybe I'll put another picture of. Maybe I'll put you this time.
Of a real size 28-meter long nerve.
Yeah, I'll just put a picture of a 28-meter long nerve, and then you next to it for perspective. Yeah. Anyway, it would be absolutely ridiculous in these dinosaurs. But the thing is,
we're not dinosaurs.
We're not dinosaurs. We're not horses. We're not giraffes. No. We're also not fish anymore, apart from Svet. But this nerve doesn't just have consequences for horses or for giraffes. Maybe, I don't know. You should look it up. No. For humans, it's very important. And I am biased. I like human beings. I like human anatomy the best. It's very cool. So it's a very high risk structure in thyroid surgery, parathyroid surgery, anything really in that area where we're at risk for damaging or causing inflammation or anything surrounding the recurrent laryngeal nerve. I mean, you can imagine some of the problems that might cause. But I mean, hoarseness. So your vocal cords aren't proper. Yeah, the muscles aren't properly able to move anymore. So you have hoarseness. You can have complete paralysis of the vocal cords, one side, both sides, depending on if you damage both, but that's quite uncommon. You can also aspirate, so you can choke, you can have food that goes down your airway because the vocal cords don't close, or because, any number of things. Unilateral, so one-sided or bilateral damage. Now, it's unlikely that you're going to damage both sides, but it can happen. In thyroid surgery, it's possible. It does happen. But usually, more than anything, you're going to damage one side. Now, of course, thyroid surgery is very much in the area. It hooks up around and it goes up into the throat, right next to the thyroid, very, very close to the thyroid. So it's logical that it can cause some damage. So during surgery, often what they do is they measure the activity. So they stimulate the nerve and they measure the activity in the larynx as well, using a special intubation device, which they read the information which they gain from stimulating the nerve, and they check if the nerve is functioning properly or if they've damaged it during surgeries. So they can see immediately if they've damaged it, so they can understand, hey, what's actually the most logical next step to follow in this case. So they check very carefully and for obvious reasons. And if I have some damage to my RLN at the moment. Which I wouldn't have if it was designed logically like you, I guess. Anyways, we'll go back to that. Anyways, it's very important. Surgically, a very important thing to look into. But if it's bilaterally damaged, this can also be a real surgical emergency because, as we mentioned, the only muscle which abducts the vocal cords, so which opens the vocal cords, is innervated by the recurrent laryngeal nerve. Yeah. So if there's damage to the recurrent laryngeal nerve, it's logical that if on one side you have this kind of roaring thing like the horses with the hemiplegia, right? But in human beings is a bit different. Maybe you have some light problems breathing and you sound a bit different, but it's not so dangerous in of itself, life-threatening in that sense. But if they're both closed, then you're gonna have a real problem because you can actually develop serious breathing problems. So serious to the fact, of course, because your airway is just closed, that you might need to have another operation, say for example, to create a new airway. In the meantime, now. This anatomy is not always like this, though. Some people do actually have a normal, normal. That's a bit of a logically designed, laryngeal, non-recurrent laryngeal nerve, which you could call the inferior laryngeal nerve or Svet's second laryngeal nerve, because of something called arteria lusoria, which is the proper English term is an aberrant right subclavian artery.
Very rare. We have to make that clear.
An aberrant.
Extremely rare.
It's not so rare.
Well, they say it was 0.5 to 2% of the population.
I wouldn't say that's very rare.
That's
What is it? What is the definition of a rare disease? Affecting no more than 1 in 2,000 people.
Or 5 in 10,000. It's one of the two.
It would be 2 in 10. What?
We keep them.
5 and wait. Yeah, of course.
5 and
Yeah.
10,000.
Sorry. Yeah.
5 and 10,000.
So as you can see, we don't study mathematics. But yes, 5 and 10,000. You're right. Anyways, but in this case, it happens. It happens, and it can cause problems with swallowing this thing. And I'll show you why. Because basically, what happens is instead of the right subclavian artery having its normal course, it travels from the left, from the aortic arch, and it wraps its way around the back of the esophagus. So it can cause problems with swallowing, and it can cause problems with swallowing. Yeah. More than that, Ortner's syndrome, or also known as cardiovocal syndrome, is when you have an enlargement of parts of the heart or of the major vessels, and that can cause compression of or damage to the recurrent laryngeal nerve. Tumors, about 2 to 18%, which is a huge range, but that's in a paper I read, anyways. Lung tumors, they can present with hoarseness, which is caused by compression of the recurrent laryngeal nerve. Now, that would be a pretty horrible way to find out that you have lung cancer.
Yeah.
I mean, not that there's any good way to find out, of course, but I mean, you wouldn't expect it at all. If you have certain symptoms of, very typical lung cancer symptoms for months on end, maybe you would be like, yeah, maybe it's that. I'm going to go to my doctor. But if you have a hoarse voice, yeah, that's scary. It's very scary that can happen. Anyways, these are, without going into too much detail, this is some clinically relevant information about it. But I think that's a good point to wrap up.
Yeah.
Not go into too much detail, not talk for hours about this, because I would love to. But
with our final remarks, we're just going back to just a bit to answer maybe the most basic question, or give some insight into that, or just to refresh for people that know that. But we mentioned evolution a couple of times, and obviously evolution plays a big role here because it does make sense.
It's everything.
It's everything, and it's a long history. It's a long book of, as we said, like 300 million years where this has happened. And if you're an ignorant person, you might ask,
would you read the whole book?
I would. I mean, that's like as close to a Bible in some countries, but
300 million
pages.
Oh,
yeah. But as we said, someone might ask why isn't it that this has changed? Because we had quite a long period of time to change that. But I think there we should just mention just quickly the fundamentals of that evolution. Just takes little steps. It's not like a nerve is created all of a sudden. And that's like the next.
But you would like that, though.
I would like that because then you could just correct changes immediately.
It's great.
But it doesn't work like that, unfortunately. So that's why we still see the traces of evolution to an extent.
Yeah.
And because of these things, that's why we can't just all of a sudden make it so it's logically designed.
No.
Because imagine what would the intermediate steps be of a recurrent laryngeal nerve that's not recurrent anymore.
I don't know. You tell me. You're the missing link. Maybe you have one.
Well, you would have probably some kind of people that have maybe one recurrent, one non-recurrent.
Sure.
Mixed informations. All of a sudden, it might not be tethered to the aorta. It might be kind of free hanging.
Yeah.
So you have people with free hanging laryngeal nerve just walking around
and a higher risk of
whatever happens. Yeah. So all of these things, and obviously the all of these structures, the pharyngeal arches or the gill arches in fish, they're really the blueprint for how these are made. They're so conserved. We can go into the Hox genes and whatever, but we're definitely not doing that now.
No, we're stopping.
But for people that want to do that,
you have fun.
Have fun with that.
It's a fun one, definitely. It's whimsical. It's hypnotizing. Eye-opening.
It's open there.
Let me open it properly. Let me open it and really take a look.
But yeah, all of these things. So that's important to also take into account when you think about some stuff that were consequence of evolution.
I mean, that's the thing. We assume this kind of perfection. We assume that evolution works towards perfection, but in reality, it's a compromise between perfection and what it's functional in the moment. And slowly, over time, we develop things that are necessary, and they compile, and they're not always going to be pretty.
And it's a modification of these structures. That's also important to know. It's not a completely new structure that's made.
Yeah.
But that, I think now it's a good time to wrap up for two main reasons. One, we're mostly finished. Two, there are two people standing in front of the door.
Again.
So we will say bye.
Yeah. That's a good time to say goodbye and leave it at that then.
Yeah.
Goodbye. See you next time.
Next time.